In a word, Beverly, it's not. Socially critical, which is, as you said, the wording that was used by the Danish Prime Minister in announcing the lifting of the measures, actually touches on, I suppose, three aspects: the impact on economies and livelihoods, the impact on legal rights and responsibilities, and then, of course, the impact on health. And right now, we're looking at the first two and have decided with Omicron, the last issue is solved. And that's really not the case. Sort of three things to consider. We have the equivalent of a global split screen with Omicron, with health systems buckling around the world. And in the communities where those hospitals and health systems sit, life going on a bit as normal. In 2020, we clapped for health workers, but since then, in our push on vaccines, we've really not spent the resources and time on the health systems that take care of patients, but also deliver vaccines, for example, on health workers and syringes. And secondly, there is a growing evidence around long COVID that there are serious syndromic effects that we need to study more, even when you get mild infection, possibly around impacts on the brain or immune system. And three, this is a global pandemic by definition, with variants that develop in one part of the world and spread to another. And COVID cannot really be considered socially not critical in one country while it rages in others.
Yeah. I like that description you have of that sort of split screen. I mean, we're talking about living with the virus. This is how many countries are trying to frame it, but the response has been so varied, hasn't it?
It has, very much so. And I guess that gets back to my first point, that that this pandemic, this emergency, takes place in a set of economic systems, legal systems, and public health systems that are as varied around the world as the response has been. So naturally, probably, I suppose that variation should be expected, but the science remains the science. And there are ways for countries that have advanced their vaccination programs to responsibly advance at this stage of the outbreak. You have at one end the continuation of zero COVID policies in some countries like China, and in others like the UK, you have a complete opening up. And the issue is, in those countries that are completely opening up, they're treating the public health measures as sort of one block, which of course they're not. Reopening businesses and schools with infection rates dipping and vaccination rates reasonably high, like they are in Denmark. They're one of the highest in Europe in terms of booster shots. Over 60% have them. It could make sense, but getting rid of masks and vaccine checks and no restrictions on the number of people at an interior space makes no sense right now when you have a very infectious variant going. For instance, Thailand has had a very strong response, but it's also opening back up, but is keeping vaccination requirements, keeping a test and go approach for incoming visitors. So there are ways of doing it responsibly.
Yeah. So what would the behaviour be, do you believe, to hasten the end of this pandemic?
Well, yeah, the end of the pandemic, I guess we'll know when that happens, when I come to see you, Beverly, and we do this interview in person. But anyway,
I'm looking forward to it.
You know, the pandemic, eradication of the disease, we've only ever done that once. That was smallpox. And elimination, we've done that with some diseases in certain parts of the world, malaria, polio in the Americas, for instance. But what we're looking at with COVID will be control, and that's what we hope to achieve. And it has to be achieved globally, not just in one region or one country. And unfortunately, we're not on track to control because of our focus on vaccines and not enough on vaccination programs, particularly in countries with the highest risk of developing new variants, which would be countries with very high HIV rates. And by the way, none of those countries, the highest HIV rates, have even 30% double vaccinated, and many are below 15%, and none have 3 doses. So the issue is, we have lots of doses now, potentially, for application globally. We have a global syringe shortage of anywhere from 2 to 5 billion syringes, not enough health workers to vaccinate and care for patients, and hence global vaccination rates are quite low. Only 10% have gotten 1 dose in low-income countries, and no country in Africa is offering booster doses. So our push in 2022 has to be on vaccinations and vaccination programs. And it'll be a push to make much stronger immunity levels as much as possible in LMICs, while responsibly opening up our lives again in countries that have achieved a reasonable immunity level.
Yeah. The issue, though, Edward, is that there are a lot of countries where there is a real lack of motivation, particularly by the population, to get vaccinated, to properly implement those. We've seen vaccines just go to waste. How does that inhibit the progress globally?
It's been a big impact, and there are a number of factors around the wastage issue. You've got, like I said, not enough support for vaccination programs on syringes and health workers. You've got vaccine doses arriving very late, unfortunately, for countries, and Indonesia had to get rid of 1 million doses just recently. But you do have that hesitancy, and we need to be working more on the sort of local issues. Vaccine hesitancy is something that existed before COVID. It'll exist certainly after COVID, but we have not spent the time to understand the reasons behind it in different populations around the world. The reasons that people are not getting vaccinated in downtown New York City are very different from the reasons they're not getting vaccinated in Lusaka, Zambia. And the local programs and investment in that needs to be part of the solution.
Great to talk as always. Thank you so much.
My pleasure.